Hi friends, welcome to Dia's tutorial. So in this video, I'm going to talk about what are the don'ts before getting into physiotherapy practice. So we must know what we should not do because we can do mostly everything, but few set of things we must need to know what not to do. So first is never get a physiotherapy treatment or anything. Never do a treatment based on the prescription of a orthopedician or other doctor because they just mention as IFT 10 days this region. This is what you get in a prescription, and if you are going to follow that, you will lose the patient because once okay, let me explain. If a patient comes with you with a prescription and you are going to follow that, and next time will the patient come to you or go to that orthopedician? They will go there. They won't come to you. To make the patient come to you, you must do a set of things. Like you must explain the patient this is not enough. I will do my assessment. I'll add on some more things more than this. If the orthopedician has said only IFT, I'll give you IFT, but I'll also give my own treatment. Do some hands-on techniques and give them results. They will trust you. This is the number one. And also your in patients, the flow will increase. Yeah, the patients who are preferring you will increase. The second is before going into the treatment of any condition, know what you should not do. For example, you are treating a hip arthroplastically, then you must know that you should not take the hip flexion above 190 and you should not do adduction. If you don't know this and if you take the hip flexion more than 90 degree, what will happen? The implant will come out, slide out. So these are the certain things which you must know it before. Third, you must be able to be in a position where you refer your patient to other specialists like a nutritionist, speech therapist, and other persons so that your profession will grow and people trust you and the results which you are going to give will be awesome. Fourth is that know who are your patients and who are not your patients because you can't treat every pain. For example, if a patient is having some condition related to liver, they might have a low back, similar symptoms to low back. And if you are like, no, I will treat this pain, no, you are not going to get any results. And the best option is to refer the patient to other doctor. So these are the small things which will help you in your practice. Thank you. Do follow to Dia's tutorial and put your comments below to know more informations